Hello everyone. Today we are here to discuss the domain that is the communication with patients and families. As we all know that in the Part 3 MRCOG exam, we are tested in the 5 domains. That is communication with patients and families, communication with colleagues, patient safety, applied clinical knowledge, and information gathering. So, this domain, communication with patients and families, this is also a very important one, but sometimes candidates fail to pass this domain and they are marked down. Actually, communication with the patients and from time to time their families is a fundamental skill for all doctors in clinical practice, right? And communication, it requires different level of skill, including the ability to inform, engage, negotiate, and make shared decisions. But there are some common pitfalls which I will enumerate and then I'll be discussing about them in details. Right? So, first is candidates forget to introduce themselves and explain their role under the stress of the exam. Second is making assumptions about risk taking behavior. Third is feeling awkward or embarrassed about asking questions about lifestyle. Fourth is telling patients what they need rather than negotiating a plan. And fifth is not listening to the patient or respecting their views, using unnecessary jargon and abbreviations that the patient does not understand. So, coming to the introduction, it's something very, very basic. You're always going to introduce yourself to the patient with your name and role, and also confirm the patient's name and age. All right, so why this is important? Because the examiner, and in particular the lay examiner, will be making notes about your ability to engage with and develop a rapport with the simulated patient. Yeah, and communication is a two-way process. It involves listening to the patient as well as giving them information. So, a good starting point is breaking the ice. We all know that ice, by listening to the patient's ideas, her concerns, and her expectations. And also, communication skills include both verbal and non-verbal skills. So, the examiners will be again looking specifically for active listening, empathy, and appropriate emotional responses. So, we need to always greet the role player with a smile, say hello. But some candidates seem to believe that they should always smile at the actor at the start of the task. This shows that the candidate is friendly, but please don't do this in the task of breaking bad news, where very solemn expression is required. Okay? And the tasks assessing communication skills will be looking for an empathetic, patient-centered approach. And it is really important to look at the simulated patient's non-verbal cues as well as actively listening to them. So, if a simulated patient becomes evasive, she starts looking away or shifts in the seat, she feels a bit uncomfortable. So, it means that she is trying to give you a cue to ask more searching questions. This could be a cue to a situation of domestic violence, sexual abuse, or coercion. So, just pick up that cue and hint, And a candidate showing empathy will pause briefly if the role play becomes a bit tearful and just you need to offer her the water or the tissue. Or you can always ask her for a relative to join the discussion, right? Like in the breaking bad news. After breaking the bad news, we always pause and we always tell the patient that I'm sorry to be the bearer of this difficult news. Would you like to call someone to be with you? Is it okay if I carry on with the discussion? Right? So these are something very basic communication skills. And sometimes we forget to pause after breaking the bad news in the exam. So the pause is very important after breaking the bad news. Give the patient some time so that the bad news can sink in. Okay? Now, coming to the history taking, it's always relevant history or focused history. Now, here regarding asking questions about the lifestyles, like whether she smokes or drinks. We don't have to always apologize or signpost, because these are not illegal activities. It's something very common for them, right? So, because no one will be offended by a simple inquiry. And on the other hand, you have to be careful, because Part 3 exam will also address sensitive areas like sexually transmitted infections, contraceptive choices, termination of pregnancy. But again, here we shouldn't assume that every simulated patient will be taking illicit drugs or have multiple sexual partners. So these assumptions can provoke some angry reactions from the simulated patient. So here we need to be careful, and we have to signpost before inquiring about these habits, right? And also the examiners will be looking for a very non-judgmental approach to the patient's concerns and decisions. Then regarding giving information to the patient or the family, information should be given in small chunks, and give the information in small amounts, after which again you pause, check the patient has understood or not. After giving the information in chunks, always ask her, am I clear so far? Do you have any questions? Okay? Because allowing the patient to ask questions is very important. And we need to follow her agenda and not our agenda. All right? Because if she's asking questions, it means that she knows that this question carries some marks. So always pay attention to what the role player is saying and what the role player is asking. Because she's trying to bring you back on track if you have strayed away from the focus of the task. And they very well know what areas of discussion will award you marks on the examiner's mark sheet, right? And also you should make the patient feel that their concerns have been addressed. It's not that you go and on with your agenda and you're not listening to what the patient wants to know. So this is also a very important communication skill. Also, regarding the negotiating stations, where the patient had previous cesarean section, now she wants to have a home birth. So these are also very there will be very important communication skills in which you will be tested, because the patients will be well informed. They will come to you after going through the internet, right? So you have to inform her about the risk and benefits of the home birth. Appreciate her that yes, she wants to have a home birth, but at the same time you have to tell her about the risks of home delivery. And also remember that patients have the right to make decisions about themselves, and the principle of autonomy ensures that if a patient has mental capacity, they have the right to make decisions about their care, even if those decisions are unwise or against medical advice, right? And here the communication task will assess the ability to avoid conflict and to negotiate with the patient to agree a safe plan. So negotiating skills include demonstrating respect for patients' views while providing information to either correct misunderstandings or to provide additional information which the patient may have been unaware of. And negotiating skills include being able to compromise where it is safe to do so, but not colluding with the patient to agree a plan that isn't safe. So we have to be careful in this. And also, it's very essential that clinicians should be honest and don't overstate or exaggerate risks in order to force patients to comply with their plan of management. It has always to be an mutually agreed care plan, and let the patient take an informed decision about her condition. Now, another important point is using of medical terminology. So we should avoid using the medical terms because the patients are not medically literate. Anyway, if we use the medical term, then we have to explain it in the layman term as well. Like, for example, when we take the consent for a total hysterectomy, well, we can use the term hysterectomy, but also we need to explain them that it means removal of the womb and the neck of the womb, right? Now, in obstetrics, when we are explaining the patient meconium stained liquor, so we need to tell the patient that baby has opened its bowel. But please avoid saying that baby has done a poo, because this doesn't look nice, right? So this is all about like how we will be communicating with the patient. And at the conclusion of any interaction with the patient or their family, it is essential to be able to summarize the discussion if there is time and explain clearly a logical and reasoned plan for the next steps. This includes conveying the short and long-term plans. Like we can always tell them that we will be giving you an appointment after 2 weeks time. We will be giving you the patient information leaflets, the support group numbers, the contact numbers for the clinical access. Okay, and if we have to tell her to come to discuss the results, we need to tell them how results will be communicated to them. Need to discuss discharge from the hospital, right? The recovery and rehabilitation after surgery and return to work. So the discussion should always conclude with a final check that the patient has understood, and also by giving them a final opportunity to ask any questions. That is something very important. Before closing the session, always ask, am I clear so far? Do you have any questions? Would you like me to repeat anything? Okay, it means that you are concerned about the patient. So always keep the patient engaged when you're performing your station. It should never be a one-way communication. Please, as a candidate, you should never go on and on and on with your agenda. Always follow the patient's agenda. All right, so after giving some informations, always pause and ask her if she has any question. Now, that's something very important. So the take home away messages are introduction, confirming the patient's name and age, breaking the ice, that is inquiring about patient's idea, concerns and expectations. Well, we should we should smile and greet the role play, but in breaking bad news stations, don't smile at all, please. Your expression should be very solemn. Okay, and history has to be focused. Regarding the social habits of the patients, please be non-judgmental. Examiners will be looking at your expression. Regarding giving information, it should always be in small chunks and check understanding more. Give the role play the chance to ask questions, follow her agenda. Avoid medical jargons. If you use medical jargons, please explain in the layman term as well. At the end, make sure that the patient has understood everything, and again give her the final chance to ask any questions, address her concerns. All right, and of course, you will be giving the patient information leaflets and the contact numbers for the clinical access. So this is all about the communication. Always remember that it's two-way process, you and the patient. Okay, I hope this helps. Thank you so much.